Hi, I'm here now with Karla, who has undergone subliminal therapy treatment with Dr. Ed Yeager for the treatment of anxiety, panic attacks, and insomnia. Would you mind sharing with me why you sought treatment for the experience of insomnia, anxiety, and panic attacks?
I first felt like there was something going on with me because I couldn't sleep. And I didn't realize that because I was working 2 jobs and going to school, I had a lot of things bottled up. So it started kind of progressing, getting worse. And sometimes I would start feeling like my heart was racing, or like when I was driving, I had to feel like I had to pull over because I couldn't control. Sometimes I had feelings of short breath, and also I felt claustrophobic. And so I wanted to have some type of treatment. I had heard of some psychologist or psychiatric treatment that would deal with giving me anxiety pills, and that's something that I didn't want to go with. I definitely didn't want to go with medication, so I wanted to try something besides medications to try to cure what I was experiencing.
Okay. Did you say, I'm an insomniac, I have panic disorder, I have anxiety, or did you just have this general feeling of being uncomfortable and perhaps unhappy and a little out of control of yourself?
I knew that it wasn't something that I had experienced before, and it just started getting worse and worse. So I wasn't sure what it was. I thought maybe I had claustrophobia, and I figured maybe a little bit of insomnia, but I wasn't really sure about anxiety. I knew I was having some kind of attack, but I wasn't sure what it was exactly.
Okay. And all you really knew was that you did not want to take anti-anxiety medications, or I imagine you didn't want to take sleeping pills either. You wanted to find out what the problem was and treat it by understanding it.
Yes, I definitely wanted to understand what was going on with me before, I went with any kind of medication. I did see a regular occupational doctor, and he did recommend anxiety pills. I believe it was Xanax. He said I didn't have to take them, but and it was a low dosage, but that he would recommend them. But I wanted to find out really what it was that I needed to resolve, and if it could be done without medication, then that was what I wanted to go with.